One of the things that I'm an expert on in my local area, kind of in the Southwest, is gynecomastia. And gynecomastia affects half of all adolescent boys as they're growing up, but the majority, 75% of that half, it ends up just going away. So the remaining 25% that it doesn't, a lot of times those kids need treatment or could benefit from treatment. The definition of gynecomastia is just normal breast tissue that we all have in terms of where the nipple and areolar tissue is normal breast tissue, but it's just an overdevelopment and an overgrowth of where the boys should be under normal circumstances. And it brings up all sorts of negative connotations. One of the social, derivatives is a moob or a man boob, and there's others that are less acceptable to even say, but they don't feel right, they don't feel masculine. You really want to focus on a couple of things. You want to excise the tissue, as well as using liposuction as an adjunct to smooth the area. There's always a component of fatty tissue that's in the chest, and that's why a plastic surgeon's so much better than someone who's a general surgeon, because a general surgeon's just going to excise the area. Plastic surgeon's going to have, significantly more expertise and finesse and really give you a much better contouring issue and options. I think it's one of those things where they wonder why didn't I do it sooner, because they're really back in normal exercise patterns within 3 to 6 weeks, depending on the degree of gynecomastia. For the larger cases, it takes a little bit longer to recover. But for the smaller cases, it's quick. They're back 3 weeks, and they're back to being able to do things they never thought they could do.